Welcome to the NYU Langone Dental Advanced Education in Pediatric Dentistry program. This presentation will provide an overview of our program's centralized structure, processes, and outcome. Our NYU Langone Dental Advanced Education in Pediatric Dentistry program is based upon and steeped in a culture of excellence and accountability. Let's begin with a brief history of the founding and growth of our program, with a description of its sponsorship transition from Lutheran Medical Center to NYU Langone Health. Lutheran Medical Center was conceived of and founded in the late 19th century by Sister Elizabeth Fetty, a Norwegian deaconess and nun, whose brother-in-law challenged her to come to America and serve the underserved in Brooklyn, New York. Sister Fetty dared to accept the challenge and started the soon-to-be Lutheran Medical Center, which added dental services in 1932. After its founding by Sister Fetty, Lutheran Medical Center became the largest hospital-based federally qualified health center in 1967. In 1994, its Advanced Education in Pediatric Dentistry residency program was launched with 2 residents, and in 1996, the program was accredited by the American Dental Association's Commission on Dental Accreditation. Beginning in 2003, the program established its first satellite training site located in Rhode Island, followed in 2005 with a second training site located in Alaska. With the success of the Rhode Island and Alaska satellite training locations, the program began a rapid growth trajectory beginning in 2009 with its training location in Hawaii. From 2009 to 2025, the program has expanded to a total of 14 training locations in multiple regions of the United States. In 2015, Lutheran Medical Center merged with NYU Langone Hospitals and was renamed as NYU Lutheran Medical Center. Ultimately, in 2017, NYU Hospitals and its health system rebranded and its name to NYU Langone Health as the residency program sponsor, and the program was renamed as NYU Langone Dental Medicine Advanced Education in Pediatric Dentistry. As the residency program sponsor, NYU Langone Health and NYU Grossman School of Medicine in New York City, and was led from 2007 to 2025 by Dean and CEO Dr. Robert Grossman, and Chair of the NYU Board of Trustees, Mr. Kenneth Langone, co-founder of the Home Depot. During his 18-year tenure, Dr. Grossman was a transformational leader in repositioning NYU Langone Health and the Grossman School of Medicine into top-tier, nationally ranked institutions. In 2025, Dr. Grossman transitioned to serve as the Executive Vice President for the Board of Trustees of NYU Langone Health and handed the roles of CEO and Dean to Dr. Alec Kimmelman, who has previously served as the Associate Dean of Cancer Research at the NYU Grossman School of Medicine. Dr. Kimmelman continues to build upon Dr. Grossman's legacy and leads our exceptional institution into its next phase of innovation and impact, further advancing our mission to care, to teach, and to discover. The U.S. News & World Report rated NYU Langone Health in its top 20 honor roll, along with other exceptional hospital medical centers across the country. While the U.S. News & World Report no longer ranks hospitals ordinally, NYU Langone Hospitals once again received the second highest total score in the nation. The U.S. News & World Report Best Hospitals ranking shows what's possible when its 53,000 employees bring their talent, skills, and dedication together to provide exceptional world-class healthcare. Once again, NYU Langone Health is one of the most highly ranked health systems overall and across its specialties, as it leads the nation with 4 #1 specialties in neurology and neurosurgery, pulmonology and lung surgery, cardiology, heart and vascular surgery, and geriatrics. No other institution had as many #1 specialties, and all 13 of NYU Langone Health's ranked clinical specialties were in the top 20 nationally, with 10 in the top 10. Let's pivot and share the details about the program's structure. The NYU Langone Dental Medicine Advanced Education in Pediatric Dentistry falls under the Division of Dental Medicine and is part of the Hans-Jörg Weiss Department of Plastic Surgery. The department is led by Dr. Eduardo Rodriguez, a world-renowned plastic and reconstructive surgeon and oral and maxillofacial surgeon who is known for his contribution to the field of facial transplantation and vascularized composite allotransplantation. The Division of Dental Medicine is led by Dr. Martin Lieberman, who is administratively supported by the multiple directors responsible for accreditation, information systems, curriculum, dental research, communications and outreach, and projects. The Division of Dental Medicine has oversight of 5 postdoctoral residency programs in advanced education in general dentistry, advanced education in pediatric dentistry, dental anesthesiology, endodontics, and general practice residency. The Advanced Education in Pediatric Dentistry program is led by its program director, Dr. Dan Kane, who is supported by the 3 regional senior associate directors and 16 associate directors. To further support Drs. Lieberman, Renato, and Kane, there are 3 regional senior associate program directors who administrate the local host institutions: Dr. Sri Krishna Akhilesh in Midwest, Dr. Rajesh Adia in the East, and Dr. David Okuji in the West. Our program has established up to 19 training locations and currently has 14 active locations across the country, which extends from Hawaii in the west to Rhode Island in the east and Washington State in the north to Florida in the south. The current number of program graduates is rapidly approaching 1,000, who are practicing, teaching, conducting research, and providing service outreach across the United States and around the world. Currently, our program is presently approved for 140 resident positions, with an annual average exceeding 120 PGY1 and PGY2 residents. As the program sponsor, NYU Langone Health provides the centralized program leadership, administration, and didactic curriculum, which fulfills the accreditation standards of the American Dental Association Commission on Dental Accreditation, or ADA CODA. The local host institutions, mostly federally qualified health centers, provide the facilities, faculty, and support staff where residents receive their clinical curriculum and training to fulfill the ADA CODA standards. Affiliated local hospitals provide the ADA CODA required hospital rotations. Of course, the program's resident providers and the host institution's patients are central and key stakeholders in the structure, with the patients as the central focus. Hence, we are one program, with one program director, many training site locations, and many associate directors. Here you can see the names and locations of our local, affiliated host institutions across the country. This graphic visualizes the geographic scope and breadth of the affiliated hospitals where our residents train, with many of the hospitals designated as children's hospitals in Arizona, California, Hawaii, Massachusetts, Missouri, and Rhode Island. Let's now transition to a detailed overview of the program. In April 2021, during the COVID pandemic, Dr. Dan Kane, our program director, shared his vision for the program's culture of excellence and accountability. Our program attracts applicants from the entire nation. In this montage, you can see a sample with the wide array of dental schools from which our residents have received their dental educations. Once enrolled in our program, residents participate in an extensive orientation and calibration program. As shown on this slide, there are multitudes of topics covered during the orientation and calibration activities, which includes orientations to program administration, research, and local site-specific topics. The centralized didactic curriculum consists of weekly live, synchronous video teleconferencing, known as VTC presentations, in addition to about 20 hours of monthly asynchronous learning modules on the Brightspace platform. The local didactic curriculum is led by the local faculty members and include literature review, board preparation, seminars, case presentations, and extracurricular continuing education courses. This tabular graphic shows the number of synchronous VTC and asynchronous Brightspace hours assigned. The program's research requirements are supported locally by a faculty research mentor, research advisor, and the centralized dental research and dental statistics departments. Residents are required to develop a research project which is presented as a poster presentation at a scientific conference and culminates in a research manuscript formatted for publication. The program provides residents with detailed guidance and support to fulfill the research requirements. This research milestone graphic outlines the research project management assignments and due dates, starting with the development of research ideas in September of the PGY1 year and ending in June of the PGY2 year with the final manuscript. The tabular graphic shows the program's clinical rotation requirements, which meet the ADA CODA standards, and are fulfilled at the local host institutions and hospitals affiliated with the program. Residents are required to fulfill the program's advocacy requirements, with many residents participating in the annual AAPD Pediatric Oral Health Advocacy Conference held in Washington, D.C. The program's faculty members undergo an ongoing calibration process which begins with onboarding administration, credentialing, access to information technology platforms, calibration learning modules, monthly meetings, faculty development conferences, and periodic site visits by the senior associate directors. Let's now look at our program's outcomes. The program requires that residents take the incoming and outgoing AAPD in-service examinations, which provide residents with an assessment of their pediatric dentistry knowledge compared to the national average. Guided by the ADA CODA, the program requires that all residents take the American Board of Pediatric Dentistry written qualifying examination and encourages residents to pass the board's oral clinical examination and become a board-certified diplomate in pediatric dentistry. Here are our program's historical average examination pass rates, which exceed the national averages for the American Board of Pediatric Dentistry examinations. Until 2021, the American Board of Pediatric Dentistry has annually awarded the James R. Roach Award to residents who attain the highest score for the qualifying examination. Our program is proud that it is one of 2 programs in the country which has had at least 3 Roach awardees. Over the years, Drs. Anna Abrahamian Ross, Ann Scaron Pedersen, and Farishta Fakiri were honored with this award. Most other programs across the country have not been distinguished with Roach awardees. The American Board of Pediatric Dentistry has annually awarded the Richard C. Pugh Award to residents who scored in the top 3% for the qualifying examination. Our program is again proud that it has the highest number of Pugh awardees in the country, with 22 residents achieving this honor. Drs. Avani Kara and Ratrice Jackson have been honored with the AAPD Resident Recognition Award for residents doing innovative and interesting activities in their training programs. Drs. John Kiang, Derek Nobrega, and Megan Sullivan Walsh have been honored with the Mary J. Houck Memorial Scholarship for their passion and commitment for the care of children with cleft palate and craniofacial conditions. In this slide, one graduate's testimonial exemplifies and summarizes the pride that many of our graduates feel after completing the program. This comment sums it up as, "The program kicked my butt, but I graduated truly prepared for my career in a way that I simply was not prepared for, even after dental school, GPR training, and a 3-year associateship." One of our patient parents' testimonial demonstrates the strengths of our program's training experience and positively describes that the team went above and beyond, the family felt safe and cared for, the team members were a pleasure to work with, and the parent was so happy with this experience. Although our program's culture is that of excellence and accountability, our residents also have fun at local events and centralized program-sponsored receptions held at scientific conferences each year. Speaking of fun, our program sponsors an annual competition called the Halloween Throwdown, with the winning training location earning bragging rights for the year. Thank you for making the time to learn about the NYU Langone Dental Advanced Education in Pediatric Dentistry program and its culture of excellence and accountability.